So we're talking about chronic ear infections, and I thought I'd show you some pictures of how we fix the eardrum and remove the cholesteatoma. We wrote this up in the Clinical Symposium, the SIBA Symposium book some years ago, but here's some pictures of the ear. This is a right ear, and we make the incision behind the ear with the patient under general anesthesia, and we expose the perforation that you can see right here. After we remove the skin from the ear canal, we use a drill under the microscope and we enlarge the ear canal so that we can see. If there's an infection in the mastoid, we can open up the mastoid, which is right behind the ear canal, and remove the disease. We take a little bit of fascia from the muscle here, and we use that to reconstruct the eardrum and to place it underneath the hole in the eardrum, and then we place skin over it and then packing. Now here's a story of fixing and removing the cholesteatoma. The cholesteatoma usually has a very small hole in the eardrum, and the main problem with the cholesteatoma is inside, not outside. When we open it up, we can see this big cyst that's destroying part of the mastoid bone. We take a drill and we expose the mastoid and expose this cyst and remove the skin cyst. The incus bone, or the second bone of hearing, is missing, and so we'll put a prosthesis in to replace that second bone of hearing. And then we put the fascia in, the temporalis fascia in, to reconstruct the area of the drum that's been damaged by the cholesteatoma. And here you can see we're rebuilding the wall where we drilled it with cartilage, and we place the prosthesis on the little stapes bone and then put the flap back and pack it for a couple of weeks. And that usually helps restore the hearing and removes the disease from the ear. Patients have to be followed for a period of time to make sure there isn't a recurrence. Sometimes there's a recurrence of this cyst and it has to be removed at a later time, also a year or two later.